Medicare helps millions of seniors with their health issues every day. But like most government programs, it isn't perfect. Traditional Medicare comes up short in dental, vision, and hearing coverage, and doesn't cover hearing aids at all. Hi, I'm Jeff Hoyt, Editor-in-Chief of SeniorLiving.Org. Dr. Brad Ingrao believes that Medicare should cover more hearing services, including hearing aids. In this video, the audiologist will explain why Medicare does not cover most hearing services, the hearing care Medicare currently covers, how Medicare patients could get low-cost hearing aids under the program, why Medicare should cover hearing services, the legislation that mandates that under consideration, the obstacles currently in the way, and how much hearing aids will cost under Medicare. Because Dr. Ingrao is in Seattle and I'm in Los Angeles, we will be conducting the interview via Zoom. Hey, it's Jeff Hoyt, Editor-in-Chief of SeniorLiving.Org, and today once again I have the pleasure of speaking with Dr. Brad Ingrao, who is an audiologist, and we're here to talk about Medicare and hearing. Thanks for coming, Doctor.
My pleasure, Jeff. It's always nice to be here with you and talking to the folks here at Senior Living.
Well, let's start out with hearing aids, which can be very, very expensive. And Medicare, do they cover hearing aids?
They actually don't, which seems a little counterintuitive, but Medicare was really designed to be kind of similar to the private insurances of its day. And at that time, people were really concerned about major problems. So catastrophic, you get in a car accident, you go to the hospital, you need an operation, or regular care that you would get from your primary provider. So hearing aids weren't in that sort of lens of healthcare at the time. And so they weren't included, and they've never really been included afterwards.
I see. So what hearing care does Medicare currently cover today?
The big differentiation between what they cover and what they don't is sort of the purpose of the test. So a hearing test for diagnostic purposes. So if you go to your primary care provider, your physician or your nurse practitioner, and you say, look, I'm just not hearing as well as I used to, and I want to find out what's going on. They can refer you to my office, and that hearing test for the purpose of diagnosing what's the problem, that's covered. It's covered under Medicare Part B. And the idea is that's a medical referral to determine the cause of some reported disability.
If my physician sends me to you for a hearing test and says, check out Mr. Hoyt's hearing, then that should be covered if I were on Medicare. But
that's
if
correct.
They say, check out if he needs hearing aids, then it wouldn't be covered?
That's where it gets really tricky. So yeah, the first scenario where please check out Jeff's hearing, great, no problem. But if the physician says, I believe that Jeff needs a hearing aid, help him pick one out, hearing aids are specifically not covered by Medicare. And so if you're just dealing with pure Medicare Part B, they also don't cover services related to hearing aids. So there's a in billing for insurance purposes, we use things that are called codes. We have CPT codes. If I put on the bill the diagnostic codes for your hearing test, and then I put in the diagnostic code for selecting a hearing aid, chances are they're going to reject the entire claim and you're going to get a bill.
Well, we wouldn't want that. Now, what if I just came to you directly without seeing my physician, said, hey, about Medicare, can you test my hearing? My wife says the TV's up super loud at night, and I think it's as loud as it ever was. So will Medicare cover that?
No. They're going to actually reject that because you don't have the referral. And part of the reason for that is audiologists currently under Medicare are really only authorized to do technical services. So those technical services have to be authorized by a provider. And so your physician, your primary care physician, or your nurse practitioner, or whoever is authorized by Medicare to be your primary provider is a practitioner. And currently I'm a provider, but not a practitioner. So I can do those technical components, but you need to ask me to do them.
So we're getting to sort of the technical aspects of these things, but overall, Why should Medicare cover hearing services in the first place? It all comes out of tax dollars, and we all feel we pay too much taxes as it is. So why should Medicare pay for hearing services?
The simple answer is that good hearing is good health, right? We have lots of good research going all the way back to the early 90s that shows a direct correlation to untreated hearing loss and reduced overall quality of life in a health domain. And so what happens is my hearing starts to get a little bit less good, and I stop going to my favorite restaurant. And then afterwards, I stopped going to all restaurants. And then afterwards, I stopped going to family gatherings because all of those things are difficult with my untreated hearing loss. And little by little, I withdraw socially. And that puts me at risk for mild depression. And maybe I don't get out and walk around as much. I might talk to somebody that's difficult. So I start gaining a little weight. And now I'm a little depressed. Maybe I have pre-diabetes and my blood pressure goes up. All of those things make me less healthy in general. And ironically, if Medicare covers all of the treatment of all of those things, but they could cover my hearing aids, which is a primary treatment for hearing loss for most people, you could prevent all of those other things. Now, the hearing aid might be an expenditure once every 3 to 5 years. But those treatments of depression and diabetes and blood pressure, those are ongoing for the rest of my life. And so it's kind of, shooting yourself in the foot. Cutting off your nose to spite your face, I think, is the analogy, the term I'm looking for. But we're spending money over here, and it ends up being a lot more money in the aggregate in the long term than we would have spent over here. But that's the way the system is built, and until we change it, and unfortunately, because it's taxpayer money, it has to be changed with legislation.
Are there any attempts to change the system through legislation today?
There's a couple, yeah. So one of them is being led by the audiology community itself, which is the Medicare Audiologist Access and Service Act. And this is trying to elevate audiologists to that provider status. And so that would, according to the people who are promoting this, create more access, direct access to audiology services. And then if you come to me for a concern about hearing, and it turns out that you need a hearing aid, it doesn't negate your coverage for that evaluation. So that's the purpose of that. Bernie Sanders and a few other people are also looking at a bigger picture and saying, look, Medicare is healthcare for retired older Americans. And older Americans need health care, but they also need dental care, they need vision care, and they need hearing aids. And so that's probably going to be a bigger lift because it's going to get into some of the obstacles I think that have been around for a while, one of them being how we price hearing aids.
Once again, hearing aids are considered expensive. So do you want to go into some of those obstacles and how that pricing model works?
So traditionally, hearing aids have been sold, even before audiologists sold them, as what we call a bundle. So you give me $4,000, and for that $4,000, I give you 2 hearing aids, and I give you a whole series of services involved in fitting them, calibrating them, adjusting them, and then following you for some predetermined amount of time after the sale. And then when you buy new hearing aids, you pay me another bundle and you start over again. The challenge with that is it's hard for an organization like Medicare to work with that system because you're buying a thing and then you're buying services, and Medicare is used to buying services, but this thing is actually charged at a much higher rate because we're including the services. And so we have to figure out a way to unbundle those services. And that becomes a little challenging because I don't believe that audiology as a profession has done a great job in documenting the value of our services or indeed the cost of our services.
I have no experience with hearing aids, but I've been fitted for contact lenses, and it seems similar that I'm not only paying for the lenses, but I'm paying for a professional to evaluate my eyesight and to recommend lenses. Sometimes they recommend a new prescription, sometimes it's the same old prescription I've had for years. But there's also a period of time where I take them home and I go, hey, these were great, I'll buy a bunch, or hey, these weren't so good, can we try other ones? So once again, it's sort of services and a product.
Yeah, and there's some attempts to separate those out, and there's some hybrids that are out there. I think that eventually Medicare will probably look at some other agencies within the government that purchase hearing aids, and the one that I'm very familiar with is the Veterans Administration. So any veteran who is eligible for general health care is also automatically eligible for hearing care, including hearing aids, cochlear implants, and what are called bone integrated or osseo integrated hearing aids. That system is completely unbundled. So they go to the manufacturers and they contract and negotiate a very low rate to pay for the device itself. And for that device price, they get the hearing aid basically and the warranty, and that's it. And then all of the services are provided within the VA healthcare system. And so the interesting thing about that is, as a previous supervisor in audiology, I know what that number is. And that number is much, much lower than the best wholesale price I can buy a hearing aid at. And it's simply because of volume. So I feel that if Medicare were to say to their friends over at Department of Defense and Veterans Administration, hey, can we get in on that contract? Then the numbers of people buying hearing aids through the federal government would be astronomically higher, which would even drive those prices down a bit. Then I could see you as a Medicare patient and recommend a hearing aid and get paid for all of my individual services to evaluate your hearing, to select the hearing aid. And then I would order the hearing aid, but the bill for the hearing aid part, only the part would go to the Medicare. And then I would bill Medicare separately for the services, including the follow-up services. And you might be a person who's never had a hearing aid before. And so then you would probably need more follow-up services in that first year to learn how to use the hearing aid, maybe some auditory training, some rehabilitation, that sort of thing. But if you've had 3 sets of hearing aids before, you might come in, we do the basic setup, and you're good to go. And so I think that in the big picture, Medicare would save a lot of money because, again, by getting people good quality hearing healthcare to address their hearing loss, we save the long-term costs of all of those additional health problems that pop up, not directly caused by the hearing loss, but coincident to the untreated hearing loss.
So in your scenario, whether I'm a first timer or I'm on my 4th pair of hearing aids, what would the cost be for the seniors on Medicare?
Well, that's where it gets really interesting, because if it's built into Medicare Part B, then it would be the same as anything else you get under Medicare. So you have your 20% deductible or whatever. Now, it could be that because of the volume and because of the increased discount on hearing aids, Medicare could afford to not even charge you that. So there's a possibility that the cost would be a couple of $100 maximum versus several $1,000s in the current system.
And before we close the door on Medicare and hearing aids altogether, we should point out, if someone does need a hearing aid and knows that they'd rather not face this expense that is eligible for Medicare, could they find a Medicare Advantage or a supplemental Medicare plan that would cover hearing aids?
Absolutely. There are several Medicare Advantage plans that do cover hearing aids, either as a fixed amount of money. So we'll give you $3,000 every 5 years that you can apply toward hearing, almost like a voucher. Some of them also have closed networks where they do their own, the network does their own negotiation and buying the hearing aids. And so you go to one of their providers, and the provider is an employee of the network. So they bill out the services that are eligible to Medicare. And then because you paid the additional premium for the Medicare Advantage plan, that covers those services that are not covered by Medicare Part B. It also covers your hearing aids, which are either made for that network specifically or are contracted, discounted versions of the traditional, what we call Big Six manufacturers.
Great. Well, thank you for clearing the air. Hopefully, the next time we talk about this topic, we'll be talking about the changes in Medicare that allow seniors to get hearing aids. Thanks again, Dr. Ingrao.
You're very welcome, and I'm happy to talk anytime.